Hi everyone, I am Dr. Vinoth Kumar, Senior Interventional Cardiologist from Care Hospitals, Tech City. Most of the times my patients used to ask what precautions we should take after stenting or bypass surgery. Generally, if the stenting is done or bypass is done after a major heart attack, then the bed rest requirement number of days will be more. So it all depends on in what condition we did the stenting. If the patient reaches the hospital on emergency basis and if the major heart attack is there, definitely after stenting he needs to take a rest in the house at least some 3 to 4 days till the heart pumping improves. If the patient undergoes the stenting as electively because treadmill test is positive or something, it is done on elective basis, not on emergency basis, means most of the times patient can resume their routine activities after consulting the cardiologist within 2 to 3 days. If the patient pumping capacity is very low, when the EF ejection fraction is less than 40%, most of the patients will require some amount of bed rest for the initial 10 to 15 days. That is not bed rest, they need at least minimal activity followed by graded manner, they should resume their physical activity. If the patient is having very much low pumping less than 30% and if the patient is very much breathless, definitely they need at least 2 to 3 weeks of decongestion, that is removing water from the body. Once they are free from breathing trouble, then slowly they can resume their activities. This is regarding the physical activity. Number two, they should take all the medications, blood thinners, whatever the blood thinners given after the stenting. They are very important to keep the stent patterns, especially during the initial 3 to 6 months of therapy. We usually give up to 1 year following a major heart attack. That is very important. Don't skip the medicines. For some dental extraction or for some other minor procedures can be postponed up to 3 to 6 months. If at all any emergency surgery has to be done following within 3 to 6 months of stenting or bypass surgery, definitely you need to consult your cardiologist or discuss about the discontinuation of the antiplatelet and how to discontinue, how many days we have to discontinue before the procedure and after when to resume. All these things to be discussed in detail with your doctor because the number of stents deployed, the nature of the lesions, blocks in the heart and basic pumping capacity and all those things and your diabetic status, all these things will decide the risk of following surgery. So you should always discuss the doctor and definitely it is not that you are not going to undergo surgery. Any emergency surgery definitely patient has to undergo accepting the minimal risk of stent thrombosis or sudden closure and resulting in major heart attack. But the chances are very less if you are postponing the procedure usually after 3 to 6 months. And dietary patterns. Most of the times after stenting, majority of the patient will have indigestion because of the aspirin tablet which we give, which will cause some indigestion. Usually this will resolve with the proton pump inhibitors what we give or other medications for the gastric trouble we give. That will settle 50% to 60%. Some people will have more difficulty, some will have little difficulty. It all depends on if you discuss with the doctor, maybe probably they will increase the medications for the gastric trouble. For the gastric trouble, you are not supposed to stop the blood thinners without asking the doctor. Whatever you want to discuss, you always discuss with your doctor and take a decision. Next important thing is about motions. When the patient is not passing stools very comfortably, discuss with the doctor. Don't strain in the bathroom, especially if you have low pumping capacity. In consuming more nuts and flax seeds and some of the items, medicines, doctors will give you following stent or angioplasty or bypass surgery, which will be helpful to relieve your bowel problem and you will feel comfortable. Thank you.